Did you know that hydrogen accelerates recovery after a stroke? At least that's what a scientific study conducted in Japan claims, showing that adding hydrogen to standard treatment improves brain imaging results and speeds up the recovery of brain tissue. In short, we will explain exactly what happens during a stroke. Ischemic stroke, also known as a cerebral infarction, occurs when a blood vessel in the brain becomes blocked, cutting off oxygen supply. This damages brain tissue and causes loss of neurological function. Even after treatment, recovery is slow and some impairments may become permanent. So how does hydrogen therapy help? Research shows that hydrogen aids recovery by reducing inflammation and oxidative stress. It protects neurons, improves brain function, and accelerates the regeneration of damaged tissue. Here are more details about how the study was conducted. Under medical conditions, scientists observed two groups of patients who had suffered a stroke. Group 1 received standard treatment without hydrogen, and Group 2 received standard therapy plus hydrogen. Hydrogen was administered via intravenous saline solution, and patients were monitored using MRI scans. The results showed that patients receiving hydrogen had faster brain tissue recovery, better MRI outcomes, and shorter time to regain normal brain function. In summary, the study proves that hydrogen therapy can be a valuable aid in the treatment of stroke, and although hydrogen does not replace standard therapy, it significantly improves its outcomes. In short, the main advantages of hydrogen therapy are as follows. It speeds up recovery, improves brain indicators, is safe to use, and has no side effects. I am Stefan Panayotov, owner of HHO Bulgaria. For nearly 15 years, we have been researching and practically applying the benefits of hydrogen for human health. To learn about hydrogen therapy for treating over 140 diseases, explore one of the world's largest databases of scientific reports on the topic, published on our website, hhobulgaria.com.